see everybody kind of going ding, ding, ding as they come in, I hope. So it's starting and you can see people are joining us. Hi, and welcome everyone. This is Jhb Musa. Welcome. As you come in, I think we'd like to understand where you come from. So please start filling in that poll so we can see where you're from. I think we are getting 17, 18, so there's a few people coming. So let's just let that come in together. I think I need to have a way, welcome and have a seat. Take a chill pill and we start in 2 minutes. Actually, let's get this video going, which might be even nicer. This is my favorite song so far, eh? So thank you all very much. I'm Jhb Musa. I'm a family physician in Johannesburg. Welcome to this webinar. It's a CPD meeting on Fridays. We may have to change it because it's not the best time to hold it. I hope we're not going to keep you away from work. As you can see, we have people who are from across, let me just quickly share the results. You can see family physicians from across. There's some others, medical officers, professional nurses. Welcome and thank you for joining us. Across Johannesburg and some outside of Johannesburg. So I hope you find this CPD meeting very useful. We basically have 2 people online who will be speaking to us this afternoon and more others that will join us. Our panelists today are Nonhlanhla Mbenenge. She's a doctor from Charlotte Maxeke, the NHLS there, and working, I think, in the virology department, Nonhlanhla, and she'll introduce herself in a bit more detail. Together, we'll be going through what is involved in testing for COVID and how you might be able to understand it, particularly the issues around it. And she'll field some questions, and hopefully we can clarify all the difficulties people might have as we are rolling out the testing across Johannesburg and beyond. Vanessa Govinder is from, the Healthcare Matters, if I'm not mistaken, who's going to talk about what, later facilitate the half-an-hour session that we're now going to include as a regular in our process every week, where we look at your mental health and how things are happening in terms of, your experiences being at the front line. Vanessa will talk more about that later, and she'll start at 9 o'clock and we'll finish at 9:30. So I hope you find that useful. Let me perhaps just allow Vanessa to just introduce herself briefly. Vanessa, if you don't mind, that you just tell us a little bit about yourself, and then I'll go into the videos. Nonhlanhla, Vanessa and Nonhlanhla. Go ahead, both of you all, just present yourself briefly, if you can just talk a little bit more. And Vanessa, you can go ahead while I get Nonhlanhla.
Thank you. Thanks so much. Good morning, Prof, and good morning to all the participants. This is my second session joining you. I'm an occupational medical specialist at the Wits University School of Public Health, and together with you, we hope that we can fight this COVID together and provide the support that we all need from each other as healthcare workers. But over to Nonhlanhla, and I'll chat with you again at 9, together with our partner here, which is ICAS, and we'll do a bit of breathing, so please stay on right till the end. Thanks, Prof. Thank you.
Great. Thank you. Appreciate that, Vanessa. Nonhlanhla, do you want to just introduce yourself a little bit more? Tell people about yourself.
Morning all. My name is Nonhlanhla Mbenenge. I'm the clinical virologist in the Department of Virology at Maxeke. We call it CMJA. I work there as a full-time clinical pathologist and a lecturer in the department. But I'm still under NHLS, all the NHLS questions, yeah, I'll hang it. Thank you so much for inviting me.
I really appreciate it. She came in really literally last night, was told, please help us. And so she's here and I really appreciate her doing this. Thank you, Nonhlanhla. I just want to get to my screen quickly. I'm basically going to switch off my video. I'm sitting at work and it's a very unstable connection. And I'll just ask the others if we can just switch off video as well. And let me just quickly, and let me just switch mine off as well. So basically, I'm going to go through the testing briefly, show you some videos. Nonhlanhla will perhaps chime in some if she feels she needs to add, but we'll go through these videos. And then if you have questions about this, she's already got some questions that were sent through yesterday, and we'll try to go through them. I think Nonhlanhla's got them with her. Essentially, I would like to point out this resource that you see in front of you, which is it's on my blog for Johannesburg, the COVID response. So if you go through to COVID-19 on profmusa.com, go to Johannesburg and you'll see this page, which we are going to talk to and basically just share a little bit for focusing on the testing issues, but have a look at them more carefully. So as we've talked about before, there are a number of useful resources that are there in the space, and you need to actually familiarize yourself with it. So go have a look and open these documents and save them. The one is that there is a plan for Johannesburg which is signed, and it essentially sort of talks about how triaging will occur in all clinics, and in which, and CHCs, in which we would try to sift out anybody with a suspect, with questions that suggest a patient that could have COVID, and so we're trying to manage that. I'm sure you'll see that happening at your facilities, so be on the lookout. We're busy rolling out across Johannesburg that gets implemented fully. So the second document that you see in front of you is the COVID-19 primary care facility preparedness guideline, which is an enhancement together with the Infectious Disease Society in South Africa for Johannesburg to try and implement an enhancement that talks about creating zones within the facility, which is, on a yellow zone where people are coming in and then being organized, set triage. Once they triage, they try to triage either into an orange zone, which is where these patients have COVID symptoms, or a blue zone where they are part of the normal facility. There are some basic measures in that space, but more or less the normal services carry on. There's a hospital facility version. There are posters that we're trying to put up. There's a reporting tool that we're trying to create, but I think that might be slightly outdated. A patient information sheet that we're trying to get to all clinicians to hand out. So if you've got that, use that maybe as a guide to try and advise patients. There are other tools as well, which we'll put up here. These are the questions that COVID-19 PHC triage questions are. What questions are being asked at the top at the triage section, the yellow zone. An important problem is we're finding that people are saying, we run out of hand sanitizers. And then a key thing in this process of triaging is to make sure that patients don't jump chairs, and that every chair, plastic chair, preferably is cleaned after a patient gets up. So bleach or Jhb and mixing it is a very useful solution, and it can really make us get ahead in all our settings. I also want to point out to you, there's a guidelines for cloth masks, and I would strongly advise that you go there, look at what is required, what is recommended. You saw the president last night using them. We want to encourage everyone in the community to get making their own masks. And there's another website, which a link I'll provide here, which has got a lot of other suggestions on how to make them, etc. So that's just the policy from the Department of Health. So just to mention, there's designated facilities. There are a number of them. These are actually where there's testing, and unfortunately, we're not getting much testing happening. It seems to be very slow, and we've been able to try and get them moving faster at the community health centers as family physicians. And the 6 sites, basically, you can see the sort of video here of the Helen Joseph Hospital, where you'll see already an example of how the sort of triaging occurs. And that's where the specialists, infectious disease specialists who are assisting us are from. We've then gone to across Johannesburg to go and demonstrate to various facility managers how to do this. And we've resolved, and most of these facilities are where we've gone to. And then there's 6 facilities that we have focused our energies on in this past week to try and make sure that that what we talked of and demonstrated gets happening. So I'm at Shiawelo, but there are 5 other places: Ebony Park Clinic, which is in Region A, Lilian Ngoyi in Region D, Alex CHC, Hillbrow CHC, and Stratford CHC. So they've all been set up this week and are already testing in each place more than 20, 25, and I think that we'll scale it up as we're going along. What we want to do is to try and increase that to higher levels. We're trying to get students, but if you know of any colleagues that would like to volunteer and join us to help this make it happen, please tell them to come along, use this site to either offer themselves as clinicians or laypersons. Even donations are great. So please tell anyone in the community, if they want to help us in any way, there's plenty of an opportunity for Johannesburg. And remember, Johannesburg is the epicenter of the epidemic in the entire sub-Saharan Africa. We have the highest across the entire continent. So we really need all the help we can. So today we're going to spend a bit of time going through the NICD resources particularly, and I'll come back to this question of the technical resources and other guidelines. We are going to talk a little bit about the dry swabbing that I think Nonhlanhla will also clarify. There are some clinical resources which are very useful, like managing pneumonia, being able to deal with COVID disease, whether from South African guidelines or at WHO guidelines. And then there's some useful resources that you can see that are very clinically valuable, including infection control. We'll go through that very briefly, but you'll have much more useful stuff available if you go through them yourself. There's some clinical rashes which have become quite noticeable. I think one is these painful toes that you should be wary of. That's becoming quite common, besides anosmia. So we're going to go through these testing videos now, and not all of them, so you can have a look at them yourself. But we want to try and go through some that we think are quite important. So let me just go through this video, which is about donning and doffing, protective equipment for non-aerosol generating procedures, which I think would be very useful.
This video is taken at the Charlotte Maxeke Johannesburg Academic Hospital. It is being conducted by the IPC team and the NHLS Infection Control Services unit at the hospital. We will start by illustrating the donning and doffing of PPE for a non-aerosol generating procedure for a suspected or confirmed COVID-19 case. Non-aerosol generating procedures can include, but are not limited to, taking a history, examining or nursing a stable patient. It is vital that staff take their time and follow the procedures thoughtfully and purposefully. Start by sanitizing both hands. This can be done by washing hands with soap and water or using 70% alcohol rub. Staff should follow all the steps of appropriate hand washing. Adequate alcohol hand rub should be applied to the hands. Then, each of the hand washing steps are followed. Once hand washing is complete, the staff will don an apron. Next, a medical mask will be put on. The colored area of the mask should face outwards. Please observe how the ties on the back of the head are strategically done so as to ensure proper fit of the mask and will assist when the mask will be removed. The tie should be done in a way that can easily be loosened during the doffing of the mask. Contour the mask to your face and ensure it covers your nose and mouth adequately. The next item worn are goggles or a visor. And lastly, one pair of gloves are worn. The gloves should be the right size for the wearer, and there should be no loose ends on the fingertips. The first item to be removed are the gloves. Please take note of how the gloves are carefully removed without touching the exposed surfaces. The gloves are discarded into a single red plastic lined bin. This is followed by proper hand washing with 70% alcohol. Next, the apron is removed from the back, ensuring the front surface is not touched. This is folded over and placed in the red plastic lined bin. Hands should be sanitized again with 70% alcohol. Then the goggles are removed, also from the back, ensuring no contact with its front surface. Lastly, the medical mask comes off. Take note how this is removed. Never touch the front surface of a mask. If nursing a patient in an isolation cubicle, please ensure the medical mask is only removed after leaving the isolation cubicle. Proper hand washing should follow with either soap and water or 70% alcohol.
Thank you. I'm going to just stop there, and perhaps Nonhlanhla, you could just answer.
Okay, so let's go over how to properly don and doff personal protective equipment.
Nonhlanhla, if you don't mind just responding to one or two questions I have as clarity that that often pitches up within the primary care setting, I mean, based on the video we've just seen. So, Nonhlanhla, the challenge is that in that video, we saw that a mask, a glove is used in every patient. Now, in primary care, that would be using gloves, taking it off on every patient. Is that true? In other words, every patient basically we see, you're suggesting we take off the glove and throw it away, as well as the apron. Is that right?
That's correct, Prof. If we want to try to minimize any infection, we need to be treating each patient individually as best as we can.
Right.
So preferably is that be the standard to remove the gloves and remove as we attend to each patient, except for the mask, only the gloves, Prof, that one would advocate for.
Right. So I think those are the little differentiations, because that was a pretty standard video, I imagine, mostly for staff in hospital who are moving between sick patients and probably touching them a lot. And it was just a one-off from beginning to end to sort of do it. But I think that in our setting, as PPE is quite difficult to manage in primary care, we're having great difficulty with how to work with this challenge and how to see ourselves as what would be the minimum by which we should work and without which we should not be sitting around and seeing patients. So I'm just questioning that. So if you were to look at what is the non-compromisable in seeing a patient, now let me just perhaps describe very briefly. We've encouraged doctors that because these patients come in with relatively minor symptoms, and they could be sitting across the desk and often 1.5 meters away. And most times we say, in this minor symptom, there's no need to even examine the throat. There's no need to, unless you have a really strong clinical indication to do so. And you don't need to, you might say, even auscultate if the patient is in front of you with mild symptoms. I've just got a slight cough and a sore throat. There's no real strong indication to auscultate. The question, and we've had some discussion with an infectious disease specialist who suggested really, avoid that if you don't need to do it. And once you do that, the question will be, well, if I were there, I'd say, well, do I really need? I'm not even touching the patient. I should actually use hand washing because I might be handling the files, etc., but I'm not really touching the patient in that kind of mild instance. But if I were touching the patient, I'd also be washing my hands. So is a glove a necessity in our mild sort of high volume environment in primary care? Or can we actually just use hand washing much more rigorously?
We can, if we're going to be washing our hands, to remember to wash our hands in between patients.
Yes,
yeah, right. Definitely one would advocate that going that route, especially in talking in terms of consultation in the rooms.
Yes.
Which is different. The video talks in terms of inpatient, if you look at that video. So it's directly talking into those patients that you're going to admit, that patients you're going to handle. So in that case, the scenario becomes different. So if you're going to be in your room, but the scenario becomes changed. If you will be able to wash your hands frequently in between patients, then you don't need the gloves. But remember, the patient is talking to you, even if they're 1 minute away. So the saliva and that will fall on the surface. So even the surface needs regular cleaning. So be mindful of that as well.
Okay, so that's actually just as important. So thank you. In fact, more than wearing gloves, we should be, because one of the problems with gloves is the likelihood is that the doctor will wear the glove and not take off the glove. Wearing the glove for the entire session because he doesn't have enough. And that's actually exactly the wrong thing.
Yeah.
He should be washing his hand and actually making sure his desk is cleaned.
Exactly.
And that's far easier to do than chasing around for a glove.
Yes.
Thank you. I think that's really handy. And I think that I appreciate that kind of thinking. So in addition to that, these aprons are also something that if I'm not going next to the patient or I'm sitting 1.5 meters often behind a desk as well, is that apron absolutely necessary in that environment where we deliberately are keeping patients at least 1.5 meters away? The desk is between and I'm sitting on a chair. Unless I examine the patient, which I can understand. If I'm examining the patient, I do need the plastic apron because I'm getting quite close to the patient. And I would probably say, you know, okay, between gloves or washed hands, I'd manage.
Prof, my take on that is that sometimes when we so used to do things as it becomes habitual, such that if you know that you now and then there will be patients that you need to examine.
Yes.
So my fear of saying not wearing an apron at all the time is a fear that one will stand up and examine the patient and realize later that they have not gowned themselves.
Okay.
But if in Israel the scenario becomes not 100%, it depends on the doctor himself and how conscious it is that we are in a pandemic situation. If you know that patients vary and there will be that business that you might rather protect yourself, I'd advocate in terms of protection. But if you know that your clinic is not that busy and what you're going to be seeing is mild patient, then I will say just take precautionary measures at all times. So that one, I'll leave it to the clinicians, the doctors themselves to navigate in terms of that system, but always falter in precaution rather than not to protect ourselves.
And I think that being conscious is actually much more the important thing than getting neurotic about protection, because your brain is probably your best protection there. And so you need to be very wary of it. So I think under the circumstance, if doctors are finding themselves with not enough plastic aprons, they should in fact simply use when they're going close to patients or interacting with the patient and in examination as an example.
It doesn't have to be an apron, Prof. Even we used to have doctors' coats, you know, if you come close to a patient, you can use your coat. It's just that at the end of the day, it needs to be washed.
Okay, so let me clarify that. So are you suggesting that that apron could last the entire day, or because the coat would be the same issue, isn't it? We're going to use it the entire day.
Yeah, you can use the entire day. Yes.
Entire day. It's one plastic apron the entire day.
Exactly.
Right. And there's no risk of transmission of the virus from patient to patient by the interaction with that plastic apron.
Unless you'll be hugging the patient or coming close to the patient, remember you will not be, it'll be on yourself. It's in terms of protecting your clothing as you examine the patient. Remember the patient will be coughing and that can fall on terms of in your clothing. So in terms of protecting yourself,
not take home, more or less.
Exactly, and we'll take exactly Prof.
Okay. So I think some people are wearing this, they're wearing this entire green contraption down to, you know, covering their entire hair. I mean, if you come to clinics, you'll see people like that. In fact, you go to Hillbrow, they look like spacemen. and they're standing around and that's the engagement with patients. Is that a realistic approach, or are they being neurotic? Because I don't see you all doing that in the lab.
We are not even doing it in the lab while we're busy with the samples, Prof. The only thing we use is in terms of is mask and the gown. That's what we use, and the gloves, of course. But in terms of going and having the patient, no. This is a BSL-2 pathogen. That means you treat it as you would have treated if it was in terms of other pathogens, your HIV, your influenza viruses. So you're treating the same way. It's just being precaution not to infect yourself. So we are not going around downing. It's the mask and the gloves, and we change the gloves. As you move out of the lab, you become yourself.
Okay, great. So I think that's great because, you know, I'm just so blown over by the neurotic approach by lots of people on the ground that are walking around with all the worst of things. I mean, the next one is the glove. I mean, the mask. You know, in that video, it actually said surgical mask. And there's so many of the, you know, even gardeners and clerks are walking around with N95s. And I was just like, my God, you know, do you not know what that is for? And it's being wasted. So are we right? Surgical mask. And the question is now the visors, we have these, not goggles, we have these visors that come down, which are even more protective of the mask. So the question would be, is, you know, people are saying, oh, I need to throw this mask. How do we manage masks for the day? Seeing these patients, I mean, we're taking off, let's say we have the apron, we'll keep them on for the day. Gloves, as we said, either wash or gloves. But what about these goggles and masks, or these visors and masks? They can last the entire day as well.
Those we use in terms of protecting aerolized droplets. If you're going to be working with a patient that's coughing, constantly coughing, then that's need to protect yourself. If you don't have the goggles, we can use the visor because you're protecting your eyes, basically, with the visor.
Okay.
If you're working with yes.
So if I'm seeing a patient, examining a patient, is the visor actually necessary?
If you're not, the visor also, you use it in terms of if the patient is coughing and you're directly close to the patient. Remember, your eyes is to protect your eyes. Right. If you don't, you use it if you don't have the goggles, then you're gonna have to use the visor. But if you've got the goggles and you've got your mask, then you don't need the visor.
Right. And I think it's quite uncomfortable to have these
Vanessa,
things
I think is Vanessa?
Go ahead. Yeah, go ahead.
Yeah, sure. Thanks, I'm enjoying the fascinating discussion.
Okay.
Thinking about us with glasses. Obviously, we wear visors, right?
Yeah, but the glasses are not, yeah, I suppose it does protect you from some sort of, you know, does glasses represent some sort of protection? I mean, if a person's wearing glasses, do they put the goggles on top or use a visor? What do you suggest?
The goggles are not protective, Prof, because you remember it needs to reach cover. No entrance, because as you bend, there's an opening directly to your eyes. Wow. So it protects that aerosolized not going through your eyes. So it covers from the forehead. So it covers the whole eyes. So it must be directly fitting or to cover.
Okay, so visors as opposed to goggles?
That is dependent on the individual. What are they comfortable with? If you're comfortable with using those goggles, then you can use the goggles. If you're comfortable in terms of the visors, you can use the visors. It's up to what's available. You utilize what's available to you. But then you'll use that if you're direct contact with the patient who is coughing or sneezing. Then that you need to protect yourself. But in terms of the distance, then there's no need. If there's somebody who is mild, who's not coughing, who just came and say, I'm fluishy, and then you don't need. But if you're going to be taking samples, that's the other thing that we should note, especially with the throat swab, there's a tendency of people want to feel like they want to gargle. And it can spike some cough there. So those are the terms you need to be protective of yourself.
Right. No, well, that sounds great. I think that the question is, I think, how we manage. I'll go to the PPE, I think, briefly before we do the throat swabs. I think we might be going a little too long. So let me just go to the next video, which is PPE for aerosol generated. So let's just talk about it. I think people can look at the video. We'll then get to the swabbing because that's really what we want to talk about. So you were mentioning that if we're doing aerosolized procedures, then really in that instance, you would be also wearing a visor or a goggle, an N95 mask as opposed to a surgical mask. And then we try to wear a gown or a plastic apron and gloves. And each patient, we take it out because you do not want to, same with hand washing, same thing you could do. And that's basically the way you approach it. So I think the principle you just clarified is that if you feel yourself at risk with a patient who's coughing, where you might either have droplets or aerosolized particles that might get into your eye or you inhale, that's the real risk you need to worry about. So if you're 1.5 meters away, you might actually wear that visor if you think this person is coughing a lot.
Exactly.
And so you can make that judgment call based on an understanding of how the virus moves along. Okay, thank you, Nonhlanhla. Let's go to the next video, which I think is about the nasopharyngeal swabs, which we have also got from, let me just make sure I share it, from Charlotte Maxeke. So let me start the video and then we'll go through that and we'll come back to the issue of
This video is
swabbing.
taken at the Charlotte Maxeke Johannesburg Academic Hospital. It is being conducted by the IPC team and the NHLS Infection Control Services unit at the hospital. We will now demonstrate.
Thank you very much. So that basically, Nonhlanhla, is what the
first human trials in Europe of a coronavirus vaccine has begun.
I must switch off. Give me a second. Right. So Nonhlanhla, we basically went through that. Any comments? I think that we had a discussion. Maybe you can just clarify that. Do you want to unmute yourself and start your video? We had discussion with
Hello? Can you hear me? Vanessa, hello? Hello?
Sorry. Hi, sorry.
Hi.
I'm
Yes.
not in the video.
Is it me or is it Prof?
I have no idea. I think Prof's talking and
Are you able to mute, and then we can? I'm trying to mute Prof, but I am not able to mute him from my side. Are you able to mute him from your side, Vanessa? And we can continue with the discussion. If you're able to see Prof's question, I'm not able to see the question. Vanessa, you unmute yourself.
Sorry, Nonhlanhla. You should be able to mute Prof. You are co-host with him.
It's
I won't be able to do that.
I think he's muted already.
Okay, I think it's coming through fine now.
Yes.
Prof, we missed you for the last 10 seconds. It was not clear. If you want to repeat yourself. Or have we lost him completely?
Yes. I'm not seeing all the questions.
Okay, let me read them for you. There's a question from Naledi Moloto. Can I wear a disposable apron and spray sanitizer at the end of the day and use it the next day? So basically it's around reusing aprons.
I wouldn't advocate that, Naledi. The issue with that is that, and if you're going to undo it and hang, you need a particular way of not touching the side that was exposed. So it will be difficult to navigate in the morning which side has been exposed or not exposed. So my advocacy in terms of that, to use once a day and throw it off at the end of the day. And unless you're one of those aprons, gowns that you know where's the inside, where's the outside of it. But because remember, if you twist it around, now you'll be infecting your clothing, and you're going to be taking your clothing home, which already has got probably some viral particles on them, which you don't want that. So in terms of an apron, I'll say once a day. In terms of the coat, I say yes, you can be able to reuse a coat.
Mm-hmm. All right, just linked to that, thank you, Nonhlanhla. There was a question from a group of medical students this week who wear their scrubs, right? And they were asking the question, should they wear a coat over the scrub? Should they wear aprons? And they were actually going to Charlotte Maxeke. So what's your advice to these young medical students, group of fifth years?
If coat or a scrub, one or in terms of the scrub. So if your scrub is the one that's going to be your clothing and you're going to hang it there and you're going to rewear it, it's fine. It's not your clothes. You're not going to be. It's not your. Basically, you are protecting your clothing when you're using the scrubbing. So I would advocate, they are fine. They are fine using their own scrub. It's the issue when they come directly to the patient. That's the issue. So if you're going to come directly to a patient, that means those scrubs are dirty. That means they need washing. So they can wear only the scrubs because that's their clothing. That's their coat. That's their gown. We'll call it a gown. That's their gown. At the end of the day, they must just go and wash it. Yeah. So we wear our own clothing. So that's why we're putting the gown. And at the end of the day, we take off the gown and we leave it at the hospital because you're not going to go and wash it at home. We leave it in the hospital and we go with our clean clothing. So that would be my advocate. If you're wearing your scrub, it's fine. Just make sure at the end of the day, it's washed.
So the point is they've got to take those scrubs out before they enter their houses, right?
No, remember, you can't take them outside. That means when you get home, you go straight to your bathroom and take it off and wash and wash yourself. Yeah.
Sure. Thank you. Thanks for that. There's another question coming through. Is a fabric surgical gown adequate protection for dentists?
Sorry, can you repeat that? Sorry.
Can you see the question? It's from Fatima Pir.
My screen seems to be, I can see there are questions, but I can't, seems to be open,
No problem.
navigate around them.
Let me read them for you. So is a fabric surgical gown adequate protection for dentists? It is difficult to get a non-penetrable suit at the moment. What, if any, additional protection can we use on the fabric surgeon's gown?
We not dealing with blood. We're usually dealing, I always say, with particles of aerosolized or droplets, you know, so they stick on the outside, so they do not penetrate into your clothing. So whatever covers your clothes, it is protective enough. We are not using the viral hemorrhagic fever gowns, even when we're dealing with the pathogen in the lab. We are dealing with gowns that will protect just our clothing in terms of those particles. So the particles will stick outside, and then if you remove that, your clothing is protected. So whatever protects your clothing, it doesn't have to be permissible or non-permissible. As long as it protects your clothing, it's sufficient. I would advocate that.
Okay, thank you for that.
I can only see one question here from Philip. It says, do you have a manual for patient that is home isolated? Have a manual for patient that is home isolated on hygiene procedures to follow, from changing bedding, clothes, eating utensils. The manual with pictures and in various languages. The manual to include advice to family of the home isolated patient. I'm not sure on Prof website. I've just been introduced to Prof website yesterday night, so I've not been able to scroll through. I don't know whether they've got, Vanessa, have got any manual there, but currently we are pathology side, so we don't have manuals specifically for patients.
Sure.
So I don't know whether we're able to answer that one.
Yeah, I'm also not sure if there's anything on Prof's website, but certainly if you look at, I just saw one the other day, it's on home-based care and community health worker protection. So really it's about IPC in the community. And I think it was through the Western Cape and certainly WHO. So at the WHO website, there is something there. Yeah, yes. I'm not sure about national guidelines, but we could do that search immediately after the session. But that's an excellent question. Thank you. Thank you for that.
Yeah. And another one from Mimi. Mimi says, how should your clothes, scrubs, coat be washed at home? And even cloth mask. Is cold water and soap fine? How long should the cloth be in contact with the soap? Is it the same as washing your hands with soap for 30 seconds? To Mimi, we are dealing with an RNA, enveloped RNA virus. So basically the washing with soap detergent is to disrupt the envelope. And once you disrupt the envelope, you are making the virus inactive. So you are inactivating the virus. So in 20 seconds, you are able to inactivate the virus. So detergent, that's what you need, detergent to disrupt the envelope. So 30 seconds, it's literally very fine to do that. So, and when you wash at home, you wash more than 30 seconds. So my advice is just not doing your washing. You're using a detergent, and that's sufficient. And more than 30 seconds and up is sufficient to disrupt that envelope. I hope I was able to answer your question. See, we also lost Vanessa there. Vanessa, are you still here?
I'm still here. I see I'm losing connection when I have my video on. So
okay.
It's not disruptive, but I'm switching my video on and off.
Okay, that's cool. That's the last question I could see, and unless you've got another question from your side as well. What I wanted to highlight before my time is up.
I think at this stage, Nonhlanhla, I'm okay. I think, you know, there's a lot of anxiety around there, certainly with shortages, with the donning, the doffing, and the disposal, the 3 Ds as I call it. The correct disposal is as important. And I'm finding that, you know, even in the non-healthcare settings at home, how are people disposing of those masks that they are using? So it's, you know, can we take the same behaviors that we're doing at the workplace and take it back home and into our communities? So that's at the back of my mind all the time. That as healthcare workers, you know, are we, and you know, firstly, are we role modeling the right behaviors, and are we taking it back to our families and communities? And how best can we do that?
It's important that what you're highlighting, Vanessa, PPE is not just PPE at work. PPE is at home. We get into contact with people, we touch surfaces, and we come back home.
We are losing Nonhlanhla there.
Are you
able to
hear me? I'm not sure. I can hear you.
We lost you for about 3 seconds.
Oh, okay. Sorry about that. I was saying PPE is very important, and not only at work, it's important at home. We chat with people, we touch surfaces, and so it is important that we bring the PPE home. And PPE at home is washing hands. Frequent washing of hands is very important. I could never stress enough, because it's so easy when you're at home to touch a surface and touch your face. So because we are in a relaxed environment. So if we constantly clean our surfaces and wash our hands, then the fear of touching it becomes less, and because our environment is protected. So my PPE at home, which I've trained my kids, is frequent washing of hands. You come into the house, you need to wash your hands. You need to be cognizant of where have you been, what have you been doing. Mm-hmm. If you feel like you're in an environment that exposes you to people, you need to be aware of that environment, and how, when you go outside, what the president was saying, wear a mask. If you're going to be in contact with people, the mask is not to protect the people from yourself, but it's to protect, it's both ways now. So you don't know the person I'm meeting. I might be asymptomatic while I'm having the virus, and I could spread to the next person. So in environments where you will be in contact with the person, rather protect yourself. And as you protect yourself, you're also protecting the others. That's what we are advocating, because we don't know at this stage who is shedding, who is not shedding. And then when you come home, wash hands. So that would be all my PPE. When you get home, wash hands. And those masks, if you're using them, just washing them with soap and water is sufficient, as I've said before. If you come in with those scrubs, just washing them with soap is sufficient. The other thing that I was hoping we can highlight in the next 5 minutes is the swab. We are advocating, I know they've been questioned, I'm raising it because that's what I'm getting from my side, because I'm dealing with testing. At this stage, we used to send 2 swabs. We used to advocate for a nasopharyngeal swab and a throat swab. And what was the intention at that time is to increase the yield of detection of the virus. And with increased surveillance and testing, we have gone to a 1 swab testing, and people have questioned that and say, is 1 swab sufficient? And I would say it's sufficient if we take a good swab, then it is sufficient. And the question is, which one, a nasopharyngeal or a throat swab? If it's possible and one has a nasopharyngeal, we always advocate for nasopharyngeal swab. But we find ourselves at beggars cannot be choosers state because we are running short of swab. If we don't have a nasopharyngeal swab, a throat swab will do at this stage. Just go to Prof's website. There is a video there that shows how to take a throat swab, a proper throat swab. If you do that, and then it is sufficient to take it to bring it for testing.
Excellent.
So the other question is whether you do bring a dry swab or we put, people are saying normal saline, or what do we put when you don't have VTM? Because we used to advocate VTM. It comes with those tubes that can be screwed tightly. Now, currently, what we have is those dry swab on the container. Whatever you have, you can use for to take a sample. The only swabs that we are not happy with in the lab, those are the wooden swabs. You know, those ones with the wood. We do not advocate for that. Please don't send us those ones. And the swabs which contain calcium gluconate, they interfere with the PCR. So those are the only two swabs that we are not in agreement with. Any other swab with a plastic tubing, we are happy you can utilize those ones. Preferably, if you don't have a screw top that can tight the fluid, use a dry swab. Use a dry swab and quickly bring it to the lab. Why I'm saying a dry swab is better than putting a normal saline is because if you put a normal saline there and it leaks, we're going to reject that swab in the lab. We're not going to take that swab once it leaks, because those things are not, they don't have a screw top, so they don't tighten when you close them. So we throw them away. We reject them. We reject them. The reject will be like, it leaked, and it's a rejection criteria because we cannot open once it starts leaking. So we prefer a dry swab. We do have a PBS or fluid for the virus to do it in the lab itself. So just take a dry swab and bring it to the lab. I think unless there's a question.
Yeah, thanks, Nonhlanhla. Did you answer this last one? Why is it suggested that cloth masks should be ironed? Would it be sufficient to have them washed with soap?
It's just to put an extra measure in terms of destroying the virus in the mask. So a hot iron, because remember I said it's going to destabilize the virus. So the iron is helping in terms of that. But washing and putting it in the sunlight is sufficient. It is sufficient to deactivate the virus.
Okay. Excellent. I see there's another question coming through. If you take dry swabs at a facility, how quickly should you try to get it to the lab?
Preferably in less than 2 days. Once you take it and you cannot send it to the lab immediately, keep it on the fridge, 2 to 8 degrees, or in a cooler box where it can stay cool, and within 2 days, bring it to the lab. If you're gonna take more than that, then we'll advocate using a medium. And if you're going to use a normal saline, make sure that it's in a tightly sealed container.
Okay, thank you, Nonhlanhla. I just took a call from Prof. Jhb and he apologized for getting cut off, but I think we managed to continue the session in his absence. It's 9 o'clock now. Are there any questions coming from the participants who want to unmute and perhaps go live? I don't see. I think we've responded to all the questions.
There is why is okay, if we've answered the ones I've seen from Mimi. Mimi ask another question. Oh,
there's
the same.
One more that just came through. Can the dry swab be sent in a blood specimen bottle?
You just have to make sure that specimen bottle doesn't have any of the what we call any inactivating factors. If it's just a clean bottle which doesn't contain anything, yes. Or if you've got those screw top specimen bottles, you can utilize that. Anything that is clean that you can put the swab, because we know we used to advocate for the flock swab. The flock swab, if you don't have VTM, they just are plain, they don't have a container. You can utilize that, but as long as you want to put them in a container that is clean. Even a specimen bottle, the one that we use for sputum, we can put them and screw it and bring it to the lab. It's fine. It's okay.
Okay. Thank you. We'll take this one last question from Naledi. On surfaces, can you use just soap and water, just like we do with hand washing? Is that enough?
It suffice. But as you look at Prof, I think it's on Prof survey as well, using bleach to clean up surface. Bleach is the better detergent in terms of destroying the virus. Cleaning a surface which we all have in our homes. You know, you've got Harpic, you've got Jig in it. So you've got many of those detergents that have got bleach in it. Those are the best liquid to deactivate the virus. But if you don't have that, definitely any detergent will help.
Excellent. Thank you for sharing your expertise and your time, Dr. Nonhlanhla. I think we've lost you there.
Thanks, Vanessa.
Thank you.
Oh, I'm still, I can hear you. I can hear you very well. Thanks.
Right.
Thanks. Thank you to everybody. I have to leave. Thank you so much.
All right. Have a great day. Thank you. So thank you to all the participants for all the questions. We'll move on to the next session, which is healthcare workers and your mental health support. So last week we introduced the two panelists who we had, which was Navlika Ratanji from ICAS and Bejo Dharmalingam, who did a breathing zone with us. This morning, I'd like to introduce you to Jia Hall, who's online with us right now. And Jia will be doing a debrief session. So what we're expecting in these next 30 minutes would be for you as the healthcare worker to share your experiences, share your anxieties. Let this be a safe platform where you can vent and get advice from a professional specialist trauma counselor. That is Jia's portfolio. She has a passion for trauma and a heart for people. And her life motto is, there's always hope and something to be grateful for. So Jia, I'm going to hand over to you, and to the participants, please stay on. At the end of the session, we'll do a breathing zone with Bejo, which will just help us cope a little bit better at the workplace. Thanks. Over to you, Jia.
Thank you, Dr. Govender. I really appreciate it. And thank you for the introduction. Like she said, my name is Zia, and I am a trauma specialist here at ICAS. So thank everyone for joining. And the last bit that I caught from what the doctor said was quite interesting. So yes, definitely what Dr. Govender said, it's a safe platform for us to talk and vent and talk about emotions. Obviously, I don't have all the answers. I don't think anyone has all the answers that we are looking for and solutions for what we are going through. But at this stage, it's just for us to see how we can work together to cope better through this devastating and stressful time. So just for expectation wise, what we're going to do is I'm going to open the platform for everyone who wants to speak up or who wants to share some emotions, so we can see what themes are coming out, and then we can address it like that. And then also when I was researching to see if I can find anything for today's session, I found an article that was done by the World Health Organization. So I'll give some of that pointers afterwards. So please go ahead if there's anyone who wants to start off and just share some emotions or where they are at emotionally.
We've lost you there.
Can you hear me?
We lost you for about 5 seconds, Zia.
What was the last thing that you hear?
World Health Organization.
Yes, so I got an article from the World Health Organization just some interesting things that I would like to share with you guys afterwards. But for now, let's share the spot and ask someone if they are comfortable to share their emotions and where they're at currently.
So while we're waiting for those questions to come through, and I'll monitor the chat box as well,
okay.
Perhaps just to give you some background, I see Navlika is online.
No, Dr. Govender, it's not Navlika. So we are using her account to log in. So she sent us the link. So it's me, and then the other Navlika that you see there is a colleague that also just called in to be present if there's a need for any additional assistance.
Okay, excellent. All right. So just to give the participants a bit of background, last week we went through just some of the issues we saw coming out of studies that were done in China. And certainly there's a lot of literature coming out from the rest of the world, you know, on type of stressors that healthcare workers are being exposed to at the workplace. So we raised and we discussed a lot of those factors, which were the emotional strain, caring for co-workers, and the shortages around PPEs, which we discussed in the earlier session this morning as well. And all these issues do cause a bit of anxiety and concerns with healthcare workers, whereas you should be putting all your time and energy on the patient, but we find that we've got to deal with our own anxiety, as well as the patient's anxieties around a relatively unknown disease for which there is no cure, no vaccine at this stage. So what's been happening over the last 3 weeks is that ICAS has been offering these sessions, these debrief sessions, once in the morning and once in the evening, and they have professionals calling across the spectrum, from doctors to nurses to managers at the hospitals and clinics out there, and sharing their concerns and anxieties around being infected themselves, about infecting their families. And through ICAS and the professional help, we were able to take them through a debrief online. So we're hoping the participants can actually share some of your concerns that are coming to the fore, and Tia can respond to you. I don't see any questions coming through. So perhaps, yeah, you can continue with the articles you wanted to share with us, and I'll continue to monitor the question and answers.
Okay. Dr. Govender, if at any time you can't hear me properly, please let me know, and then I'll repeat myself.
Sure.
Okay, so I'm just going to turn away to read this for you guys. I found it very interesting. So what it basically does is, it was compiled on the 18th of March this year. And the introduction states that the considerations presented in this document have been developed by the World Health Organization, Department of Mental Health and Substance Use, as a series of messages that can be used in communications to support mental and psychosocial well-being in different target groups during the outbreak. So it looks at the general population, it looks at healthcare workers, it looks at management in healthcare facilities, it looks at how to look after children during this time and the carers for children during this time. So I found it very interesting. I hope that some people can relate to this. I myself related to it as general population. It's very interesting. So if I can please read this to you guys. I'm not going to read all of it because it's quite a lot, but I'll just mention some of it. So the first one is messages for the general population. So this is for all of us. So the COVID-19 has and is likely to affect people from many countries and different locations. When referring to people with COVID-19, Do not attach the disease to any particular ethnicity or nationality. Be empathetic.
Yeah, we are losing you.
Can you hear me?
We lost you.
Am I back again?
Yes.
Okay, lovely. Okay, do you want me to start the sentence from the beginning again?
No, you can just pick up from the last 2 seconds or so.
Okay, so it's important not to attach the disease to any particular ethnicity or nationality. Okay, show empathy to all those who are affected in and from any country. People who are affected by the COVID-19 have not done anything wrong, and they deserve our support, compassion, and kindness. So in that, I think it's to address the stereotype that's going with the COVID-19, to make sure that we are not judged by that. We didn't do anything wrong if you get the disease, and to still see that person as not a victim, but still as the person who they are. And then the second one that's also very important is, I know that a lot of people watch and listen to the news a lot. But this one specifically addresses that to say that minimizing watching and reading or listening news about COVID-19 that causes you to feel anxious and distressed. Seek information from a trusted source. That's very important, where you read the information. Because sometimes myself, if I go on social media, there's very contradicting information that is provided to us. So that's very important. It says that the World Health Organization website is a good source. Okay, then they also said, still for the population or for the general population, protect yourself and be supportive to others. Assisting others in their time of need can benefit both the person receiving the support as well as the helper. For example, check by telephone on neighbors or people in your community for extra assistance. Okay, so then there's still a few. If you guys want, I can always share this with you on a later stage. I just want to kindly move on to the healthcare workers messages, because that's more applicable for everyone that's listening today. Yeah. So messages for healthcare workers. Feeling under pressure is the likely experience for you and many other of your colleagues. It is quite normal to be feeling this way in the current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. Managing your mental health and psychosocial well-being during this time is important as managing your physical health, which I think is a very nice combination of what we need to do. Looking after our physical health, eating, sleeping, possible, if it's possible, exercising, all those kind of things, but also your mental health, self-care, mindfulness, practicing that is very important. Then taking care of yourself during this time. Try and use helpful coping strategies such as ensuring sufficient rest and during and with.
Can you hear me? Back, please.
Sorry, did you lose me again?
Yes, taking care of yourself.
Taking care of yourself, making use of coping strategies such as taking breaks in between shifts. Like I said, the eating healthy, engaging in physical activity, all those kinds of things are very important, as well as to stay connected with family members. Obviously, I had a client yesterday that was very devastated because she said it's her first time in 27 years that she didn't see her daughter on her birthday. And although she knows that it's not that the daughter doesn't want to see her or something like that, but inside, without realizing, she feels almost rejected by her family because she can't see her family, especially on the birthday. So that's something. This is obviously a difficult time for us, but this is a time for us to adapt to technology. What can we do? How can we use technology to still stay connected with our family members? So that was something that I addressed, because I know that she said her family, she lives with her mother and her husband, which is quite a risk in the sense of elderly people contracting the disease and all those kind of things. So she works as a housekeeper at a hospital. So there was a scare, but she tested negative, so everything is well. But she said it's difficult to stay positive in these days because she can't see her daughter, she can't see her friends. So I think in this time it's important to find interesting and innovative ways to stay connected during this time. Okay, and then another one, speaks to what I just said. Some healthcare workers may unfortunately experience avoidance by their family or community, owing to the stigma or fear. This can make an already challenging situation far more difficult. If possible, staying connected with your loved ones, including through digital methods, is one way to maintain contact. Turn to your colleagues, your manager, or other trusted persons for social support. Your colleagues may be having similar experiences than you. Okay? Then I'm just trying to see which one. This is the last one for the healthcare workers, and then there's also one for team leaders and managers in the health facilities, because I know there's probably some of them online as well. Know how to provide support to people who are
again, yeah.
Sorry, can you hear me?
Lost you. So team leaders.
Yeah, so I said this is the last one that I'm going to read for specifically the healthcare workers. Then I'll read some of the ones for the management in health facilities. Okay. Sure. Know how to provide support to people who are affected by COVID-19 and know how to link them with available resources. This is especially important for those who require mental health and psychosocial support. The stigma associated with mental health problems may cause reluctance to seek support for both COVID-19 and mental health conditions. Okay, so then, which is very helpful. I know that there's probably some management for healthcare facilities also online. I believe, Dr. Govender.
That's correct. I don't have the list of participants, but I remember
that's fine.
There are some
that's
managers.
Perfect.
Yeah.
Okay. So maybe they would also benefit from this. So the first one says, keep all staff protected from chronic stress and poor mental health during this response. Means that they will have a better capacity to fulfill their roles. Be sure to keep in mind that the current situation will not go away overnight and should focus on long-term occupational capacity rather than repeated short-term crisis responses.
Thank you. Can we pause there?
Yeah.
I think that's a crucial point that you just highlighted on now. That perhaps we should stop thinking about it as a crisis and try and internalize it as becoming a way of life now, normalizing it. And
exactly.
It's very challenging because we're still going into a peak. We're still going into the season. So, but I think the more we connect with what's really going on, internalize and make it real for ourselves.
Definitely.
It's not going to be easy, but at least we'd be able to cope with the situation a bit
Definitely.
better. We have a hand up here. Sorry.
No.
Amina Dudat, would you like to unmute yourself and then ask your question? Are you there? Okay, I see the hand's gone down. Perhaps it was a
no worries.
Technological hiccup.
If I can just add on to what you just said, Doctor, I think obviously what we are going through, there's no evidence of how we can deal with this. There's no handbook on how to do it, steps to follow. This is really something we've never dealt before with in history, if I can put it like that. So obviously it's trial and error as far as we go. And it's not a normal situation, if I can say it normal, for us to deal with. But I think, like you said, we must stop thinking about it as a crisis and try and find normality for us within this abnormal situation. Mm-hmm. Find ways for us to cope, find ways for us to stay in routine, and although it's a chaotic and a stressful situation, but to find your normality and stability in this situation by trying remaining, stick to your routines, stick to things that make you feel you are coping, clustering your daily activities in manageable portions, and also reevaluating the expectations you put on yourself, because usually we are our own worst enemy. We need to revise the expectations we put on ourselves. Mindfulness, I think that's amazing. Something that everyone can read up on is mindfulness, practicing mindfulness in yourself, in your personal life, in your workplace. Yeah, so I think with regards to that specific one, and self-care is obviously very important. Then if is it okay if I read another one?
It's 9:21, Zia.
Sure, the time went by so quickly. It's so sad that we only have 30 minutes.
It did indeed. And there are no more questions. Do you want to wrap it up there, or perhaps
Okay, let me read one more, a short one, and then we can combine everything and just reflect on that if there's anything that we still want to mention. I think this is a very important one, is to ensure that staff is aware of where and how they can access mental health. Sorry, can you hear me?
We're losing you. A very important one.
Can you hear me now?
We can hear you now.
Okay, lovely. So it's important that the staff are made aware of where and how they can access mental health and psychosocial support services. Okay, and facilities where they can access these services. Managers and team leaders are facing similar stresses to their staff and may experience additional pressure relating to the responsibilities of their role. It is important that the above provisions and strategies are in place for both workers and managers, and that managers can be role models for self-care strategies for the staff. So I think obviously the employees are going through a lot, but the management as well, because they're not only worrying about themselves, but it's like a small family, hey, to make sure that if they're not okay, I'm not okay. So I think it's important that you also as management need to look after yourselves.
Yeah.
Okay, so those are just a few. Obviously, there's much more, but I just wanted to share that with you because I felt that obviously I'm not a healthcare worker, so I don't know what you guys are going through. I don't know what it is like to work in the front line with all of this. So I wanted something to show that we see you and we appreciate what you guys are doing for us. We are just a small bit of what's going on. You guys are working with us on a daily basis, and we appreciate your assistance so much. I don't think we say this enough to you guys.
Thank you, Zia. I think there were some pearls of wisdom there, no doubt, that we can incorporate and think about and take forward in our daily lives as the frontliners. So thank you very much for your...
It's a great pleasure.
This is an ongoing platform, so next week we shall meet again.
Yes, next week, Friday.
Thank you. So you mentioned mindfulness a couple of times, and our next panelist is Ms. Beju Dharmalingam. Morning, Beju.
Good morning. Can you hear me?
Yes, we can hear you.
Okay, well, thank you, Vanessa. I'm just going to jump right into it because I know time is of essence. But thanks, Zia, as well for your very enlightening messages. And what's come through so strongly, and I think we're all aware of that, is the importance of self-care. And I'm assuming a lot of you were here for the same session last week when I did a breathing technique just to try and something you can use just to calm yourself down. But I'm quickly going to reiterate it. We're not going to practice it today because I'm going to introduce you to something different again today. Another technique that you could use with your breath But mainly, you know, we talk about, yes, we need to get help and we need to get support and we need to practice self-care. But there's a very big part of self-care that is right within you, that's your breath. And how, if you harness the power of that breath, you can be giving yourself the gift of self-care pretty much throughout the day. I'm not saying that that's the only thing that's going to help you, but it will go a long way in helping to calm you down, especially now that some of the restrictions have been lifted. You know, there's going to be more anticipation, particularly on the healthcare side, that the pandemic and the numbers will increase. So everyone's waiting with bated breath to see where this is going to go. And obviously the front line and you guys are going to be the ones that are going to be hit thick and fast. So just to reiterate, last week, we tried to activate our breath in the correct way. And what I asked you to do was place one hand on your belly, one hand above your navel, one hand below. And as you inhale, make sure that your tummy expands. And as you exhale, you want to feel that belly drop. So you're breathing nice and deep all the way down from the bottom of your abdomen all the way out through your lungs. And then we talked about breathing in and out quite nice and deeply. We did equal counts on the inhale and then equal count on the exhale. And then we ended off with the technique that I wanted you guys to kind of practice, which is we inhale potentially for a count of 4 and you exhale, making your exhale longer than your inhale. And what that does is it activates your parasympathetic nervous system, which helps to calm you down. So hopefully you guys have all been practicing that and have found some benefit in that. So today we're going to practice a technique that's also fairly simple, but what it does do is you start holding the breath at certain points, and what that does is it actually allows you to strengthen your lung capacity and therefore your immunity as well. Obviously, with the upcoming kind of, you know, anticipation of numbers going a little bit crazier than they have been, you want to make sure that your immune system is in the best condition it could be. So without further ado, what I'd like you to do is just close your eyes and I will explain the technique to you. It's called square breathing or box breathing. So if you imagine a square, you're going to breathe in for a count of 4, then you're going to hold your breath. So you're not going to breathe for a count of 4. You're going to exhale the breath for a count of 4. And at the end of that, you're going to also not breathe again for a count of 4. So you can imagine it's like a square. That's how you're going to breathe. And this is an amazing technique to, one, calm you down, but also the fact that you're holding the breath means that you're starting to build your lung capacity. So again, I'd like you to place one hand on your one hand above your navel, one hand below, and so that you can feel the breath going in and out all the way from the bottom of your tummy, all the way out through your ribs and out through your mouth. So we start off just by doing 3 big deep inhales. We're going to sigh the breath out through the mouth, and then I will do 1 round with you, and I'll count you down for another 3 rounds. Just something to be aware of. It's quite different, and it's the way the oxygen and the carbon dioxide kind of moves through your body. You may feel a bit of dizziness. If you're feeling dizzy after 2 rounds of breathing, then please stop. We're going to try and go to 4, and that's kind of the prescribed number of rounds for you to feel the benefit of the breath. But like everything, the more you practice, the better it will become. I really recommend trying to do this a couple of times a day. Maybe before you even get out of bed, do a few rounds of square breathing. If you're at work and you have a little bit of time out, go and find a quiet spot somewhere and do the breathing again. Do it again maybe at the end of the day when you're in bed and you're just about to fall off to sleep. I think it will really help calm you down and cope better with your day-to-day stresses. So closing your eyes, let's take a deep inhale through the nose and exhale, sigh the breath out through the mouth. And inhale again. And exhale, sigh that breath out. And one more big inhale. Feel your belly rise. And exhale, sigh that breath out. And now we start with our box breathing. So we take a deep inhale through the nose, 2, 3, 4. Hold the breath, 2, 3, 4. Exhale through the mouth, 2, 3, 4. Don't breathe, 2, 3, 4. Round number 2. Inhale, 2, 3, 4. Hold your breath, 2, 3, 4. Exhale through the mouth, 2, 3, 4. Don't breathe, 2, 3, 4. Round number 3. Inhale, 2, 3, 4. Hold the breath, 2, 3, 4. Exhale through the mouth, 2, 3, 4. Don't breathe, 2, 3, 4. Round number 4. Inhale, 2, 3, 4. Hold the breath, 2, 3, 4. Exhale through the mouth, 2, 3, 4. Don't breathe, 2, 3, 4. Release your hands. And just gently allow your breath to come back to its natural rhythm. When you're ready, just open your eyes. And hopefully you're already feeling a lot calmer and ready to take on the rest of the day. So I implore you to please try and harness the power of this very powerful gift that we've been given, our gift of breath. The more you practice, the more you'll find that it calms you down. It's something you can teach your family and your friends, and even some of your patients if they're going through high levels of anxiety. And I wish you all a super and healthy week ahead.
We lost you for a few seconds, Major.
Sorry, I said I wish you all a super healthy week ahead. And till we meet again next time, keep breathing. Namaste. Thank you, Vanessa.
Thank you, Beju. Thank you to all the participants who have persevered and stayed with us. Please take with you these tips and the coping strategies, and have a great day. And thank you again for all your contributions to this great cause. We salute you all. Have a great week. See you next week. Thanks, everybody.